Did the password work?
Yeah, I do. It's just tell me about the username, but I always send it to anyone, so put it that in.
We could start. Where would you guys like to start?
I think the main character has bipolar mania with psychotic features, and then he manages it with substance use. I think a lot of this kind of things up.
Yeah.
Agree.
So you're thinking of primary mood anxiety cluster with the most likely diagnosis of bipolar. Okay. What evidence do you have to support the provisional diagnosis of bipolar disorder?
I think he has a lot of schizophrenia. He has got a lot of grandiose thinking. He has periods where he is not sleeping for days. It seems like a week-ish, approximately. He's high energy, constantly walking around the house. He's not communicating well with his family members, and he's like, I'm the only one who can solve it, not to go to any other resources for guidance or support. He even tries calling, I think, the police, and then it hangs up the phone. It's like when he looks at his previous novel, and he's like, I am the one who has to solve this. I have to do this.
Anyone else? Agree, disagree?
I agree.
We have consensus here. All right. If you adopt bipolar as your most likely diagnosis, as a provisional diagnosis, what does the APA require you to now do?
Rule out.
Right. Right. Or
Substance.
right. So, any evidence of an underlying medical condition?
We don't really see him taking any medication. He seems like he's able to kind of take care of himself generally.
Yeah.
So probably not, but just for completeness sake, maybe being conservative as a physician, as a clinician, we'll keep that diagnosis open and a differential. He is middle-aged, he is male. We don't know how his routine follow-up for this primary. And that's certainly, they're not going to offer that in the script. Substance use.
Alcohol use.
Yeah.
And I think that's fairly well written into the script, right? So we're going to probably have to keep that in our differential diagnosis as well, as a substance-induced or alcohol-induced bipolar disorder. So if he actually presented to practice and to your practice, and as part of a 1-hour psychiatric evaluation, looking at this idea of a rule out an alcohol-induced bipolar disorder, what do you want to know?
Kind of like the timeline of drinking. When does it start? I think he's definitely like substance abuse. That's at least 2 of the 4 cage questionnaire features for sure. But I would want to know, like, are you drinking all the time, or is it after the psychotic features have started, or so at the same time? Kind of like more specifics than that.
No. And we just don't know the prequel. I will say, this is more of a clinical pearl. I don't think you're going to get this on your shelf exam, but and especially in terms of the way this particular character presents himself, you're not going to be able to fully, I think, evaluate or provide a psychiatric evaluation without his wife being physically present.
Yeah.
Maybe even talking to her privately.
Yeah.
Because I think what he tells you, especially in the way he's acting, perhaps in the course of a manic episode, should not be deemed reliable. And even when coherent, not be deemed reliable.
It also sounds like the wife had one line where she's like, "You're drinking a little bit. You're starting earlier." So it sounds like it is always like following the initiation of some of the more manic type symptoms, like the lack of sleep, the fixation, things like that. But we would like, you'd have to ask in greater detail, like, is that a consistent pattern? But kind of had to go that.
Yeah, for our residents in training, they have to do clinical skills, or they have to perform successfully perform 3 clinical skills verification exercises. Try to say that quickly. And in doing so, we often teach them to literally draw out a timeline. And when you populate that, Siggy caps, dig fast, and then substance use. You have a nice visual in terms of onset, knowing that, and this is shelf oriented. What is that temporality that you're looking for?
1 month.
1 month, right? You got to remember that 1 month, right? Now, I hope that the board, the shelf is not going to ask you what happens if it's, 40 days or 90. I just hold my breath that they wouldn't do that, but it is 1 month. All right, so this Sinister might actually be a fictional case of an alcohol-induced bipolar disorder. Right? So we kind of have that's a working diagnosis. If, on the other hand, you've taken notes during this movie, as we discussed before, you've nerded out, and you are now going to look at your notes and cross everything off, explained by everything that we just discussed. And oh, by the way, I think we actually discussed this before. What's the percentage of individuals with bipolar 1 who will endorse having experienced psychosis at some point in their life? Yeah, right. So very, very consistent case here. Now we're going to cross off everything that is on your notes page, aka everything that you've seen and observed. Would there be anything left to develop further diagnoses, perhaps a differential, secondary, tertiary diagnosis? Because again, if your answer is no, and therefore everything that you've seen isn't in fact explained by everything we just discussed, we've nailed it. It's pretty much it, right? And you'd work the patient case very, very similar. You guys okay over there? Okay. How are they saying the audio is? It's okay? All right. Thoughts? So I'm actually taking this collective silence as perhaps nothing much more to discuss for this particular character. I did want to bring up the issue, and not that it necessarily answers this question of visual hallucinations, because within mental illness, they're relatively rare, right? But you told me that this may have an organic pathology, and the role of alcohol here could actually be to induce those visual hallucinations. So whether or not we would kind of classify that outside of the alcohol-induced bipolar or within the context of, I think, is semantics. But in either case, we really would want to tease out those timeframes.
I have a question. I think one thing I was thinking of when I was watching the movie, just like as another possible diagnosis, is like a possible personality disorder. Like, how would you kind of like maybe like a narcissistic personality? Because I feel like he was also exhibiting some of those traits. Do you like tease that away towards like more bipolar, given like the other compounding symptoms he's having?
Initially, yes.
Okay.
Because again, that thought exercise of what I just talked to a patient for an hour, and I took all these wonderful notes, and now this idea of grandiosity is glaring at me. My counterpoint to that was, well, why wouldn't that be explained by the bipolar,
Right,
and by the acute mania? And it probably is.
okay.
Having said that, I want to re-ask the question, and this is only a gut feel, so this is a clinical feel. If we get the bipolar under control and he presents to us 6 months later, working an AA program, what's your gut as to persisting grandiosity? Do you think it will go away with the other symptoms, or do you think that it may persist? And there's no way of knowing unless we actually wrote the sequel, right? But I want, so the writer director comes to you and says, hey, we want you to collaborate on the sequel. Are you going to inform that, hey, let's give this guy grandiosity when sober, or would you rather say, no, my gut is that once addressed, this guy's not going to be grandiose.
Yeah. The latter. I think he would be grandiose.
You don't think so?
I think, yeah, I mean, he definitely like has a high opinion of himself, but I think it gets tapered down a little bit when he's not in such a menace. So yeah.
Anybody else?
Mm.
There's no right answer,
No,
right?
I think it is hard to say because I'm just thinking about like the old videos that he was watching
That's what I
of
was
himself when he was a little bit, like he wasn't manic at that time, but it was like hard to elucidate like whether he was lying kind of, because he was acting as if like, oh, I'd rather cut my hands off than like, write a story that was not great and things like that. So I feel like there might be a chance that he would still be grandiose, just based off of like.
You know, another thing that might help us here is, and I don't know if there's an answer to this. What's the timeline? Do we know?
I feel like it was like a couple weeks, 1 to 2 weeks.
10 years ago.
Like when he fell and then.
And do you know when he resigned from his job? Because remember he said, because my assumption is that it was about 10 years.
Yeah.
Because with the popularity of Kentucky Blood, he resigns and he tells his wife, I can't go back to doing that. I can't go back to writing texts. Like it's below him. Now, again, when he says it, it certainly may be in the context of a manic episode. But 10 years, there is some suspicion that he did not quit his job within that same manic episode, right? How long do manic episodes last on average when untreated?
Like a.
3 to 6 months. Yeah. 3 to 6 months. So, I mean, now within that 10-year span, we're going to have relapses and remissions, and maybe he did quit. But then again, during a remission, maybe he would have went back unless there was something else keeping him from going back and accepting a menial position as a teacher.
Right.
And I say that with tongue in cheek, right? Well, it came across correct on our stream. So I would not be surprised if in follow-up, his mania has dissipated, significantly improved, but he has a character trait that we might deem to be grandiose. That would not shock me. And again, just trying to tease away the time frames. And I think the teaching point is that manic episodes on average are about 3, maybe 6 months, right? 1 week at least in terms of making the diagnosis. Right? And generally speaking, 6 to 12 months for depressive episodes. So just double it. So maybe a personality disorder. Maybe we just put it not in the assessment section, but in the formulation section. That's just something to look out for with continued care, because he'll be following up as an outpatient. Since we're discussing this, if that is the case, if we actually were able to collaborate on the sequel, by the way, the sequel, what personality disorder do you think you'd want to consider here and evaluate for? Somebody may have said it already. Yeah. Yeah. The individual who believes they are special and arrogant, and that they can only be understood by someone as special as they are. Right. So that's the kind of the cardinal feature. Yeah. Which I don't think any of us would dismiss, but we still have to make sure that it wasn't, or what we weren't really seeing was grandiosity from his current manic episode.
Right.
Good question. Next to that one. Just for, again, completeness sake, you're about 2 weeks. Well, I don't know about the intercession. 5 weeks, whatever, away from the shelf exam. What are the other cluster B personalities? I know that we could kind of pick this up from our discussion this morning. And a social way. And because they do tend to cluster, do we see any of those traits that is traits of the other 3 in this character, along with his narcissism?
Maybe some borderline traits as well.
What did you identify as a potential borderline trait?
I think as a dramaticism, I guess, isn't that like it's kind of like overembellishing everything, like the overimportance of things. I feel like can be a borderline trait.
Yeah, I mean, again, we have to tease that away from the
Yeah.
inflated self-esteem
Right,
that's
yeah.
already defining. But yeah, something to investigate, because again, we want to miss that.
Well, I guess part of externalization of blame, right? Like things don't seem to be going well and it's kind of not ever his fault, right? Like it's always someone else's fault, someone else's problem. So then some of that lens to cluster B personality disorder.
Yeah, I agree. And again, and a trait that might persist even when sober. And something, again, we'd have to look out for in a treatment plan. Anything else with this character? Do you like him? That's quick. Yeah, so. At what point did you not like, I won't say dislike, not like him?
Very
early.
live with his wife. Yeah, like,
From the
First 10 minutes?
yeah, first 10 minutes, yeah.
when she said like, are we living close to a crime scene?
Yeah.
He was like, no. I was like,
Yeah.
"Okay."
Yeah.
That went downhill.
I like him worse.
Yeah.
Oh, for
Like,
sure.
on the ranking.
Yeah.
He's lower than the actual.
I agree.
I'm not sure how much weight to put on this, but when they move into that house, I mean, literally are moving into that house, and his wife does ask him whether or not, and I think she uses the word again, you're not
Yeah,
moving us
again.
next door to a crime scene again. That was premeditated.
Yeah.
It wasn't like it was impulsive. And that premeditation might go somewhat against the idea that he's manic. Or manic, at least at the time he made that decision to move his family into the house in which that murder took place.
Mhm.
Something to consider. And what that might mean in terms of our differential. That is highlighting that maybe there is a personality disorder here. But again, we'd have to see it longitudinally. But that's something, again, that's suggestive that this might be more to it. Other thoughts about him? Anybody like him?
It didn't feel like he had any like redeeming traits, just like as a like from like the character point of view.
All right. Any other thoughts about Ellison Oswald? What are the characters you want to evaluate today?
Deputy so-and-so.
Oh, no, it's a good one.
Anybody you want?
I don't know. I feel like it's a mixed bag between thinking that it shared the vision with him, because for a while, he was like egging it on and going with the vision the reporter had. But then we also thought that he was a figment of the imagination and played more into the psychosis. If the reporter was having, like, if he was he truly there or not?
So did anybody nerd out, rewind it, and look for scenes in which Deputy so-and-so interacted directly with Ellison's wife? There were none?
Whenever the other one come on.
Mhm. Okay.
Even when he
With the
first,
sheriff.
in the beginning, yeah.
Also, sheriff is also there. Well, no, the sheriff's hand. It's about, he was one of the two cops.
Yeah, like standing outside.
Mhm.
And when he first came to the house because of all the roof,
When
like
it
when he
fell
fell
over,
through the,
yeah.
yeah, I don't think that we saw him speaking to his wife even.
Yeah, it's interesting, if he isn't real, and I think that's a valid interpretation. And when he interacted with the sheriff directly, I know that Ellison Oswald was in that scene, right? Because that's when he was moving in. But was he actually in that conversation? Because if the answer is no, we still have kind of a little bit of a hook here, right? I mean, a conversation between three people would significantly weigh against this conspiracy theory. But otherwise, if we decide that Deputy so-and-so is not real, what he does and what that would mean in terms of, for lack of a better word, Ellison's psyche is very telling, right? You mentioned egging him on. He would almost be an auditory hallucination, right? And what are auditory hallucinations? If you think about the continuum, and we could actually pick up on this morning's conversation, when we evaluate someone during a mental status examination, there are different examples of thought content and therefore deficits within thought content. Obsessions and delusions are easy examples. We kind of differentiated between the two this morning, but what are they? Like, what is a delusion? It's a thought. It's a thought in which the individual has zero insight and therefore experiences it as coming from outside of their body, right? So what that means then is that Deputy so-and-so is nothing more than the externalization of Ellison's own thoughts, right? Quote unquote, egging him on, right? Command in nature, right? Command auditory hallucinations.
And I think it was even like he also played the role of kind of that voice in his head being like, what are you doing? Because there was the whole scene with like, I would never stay a night in this house. Like if I would never have moved my family. So it also felt like maybe something in his head at that point when he started seeing things and hearing things was like, what have you done?
Now, what would be kind of cool if you guys are really, really desperate? Do you guys have independent projects anymore? So all the activities? They're coming back. Because to actually take this movie and edit out Deputy so-and-so and actually have Ellison talking to no one in those scenes might be a kind of cool look. I mean, I would watch that, right? And putting that up on YouTube and building a didactic around that would be a pretty neat and fun for a psychiatrist. Now, I don't know who's going into psychiatry here beyond our 4th years. And too bad you don't have a Scully project. That would be pretty cool. Right, but I digress. Anything else with Deputy so-and-so? Let's say he is not a figment of Ellison's imagination and is real.
I like Ernest to be part of this group, so it makes me think a little bit about a personality disorder. I'm not sure exactly what like I don't think it's fully dependent personality, like oh I want to be taken care of and part of this, it's not independent. I don't think it's any of the SVPs. And then Professor A, like maybe it's like it's a typo because we're like following into this delusion, but I feel like usually it's a typo you have a little bit more. So I just think about like a conversation we have previously where we said like Kramer from Seinfeld is like a typo where it's like a little bit more odd and eccentric in other ways, whereas like he's pretty normal except in this one.
At least as far as we know.
Yeah, that's true. Yeah, we don't know what he does in this one. I guess the second movie will tell us. Yeah.
He's the main character in the second movie.
Yeah.
That's what I figured. Because he's the only one who knows.
I guess he also is like pretty immediately like, oh, you should talk to this occult professor at the university, right? So like
yeah.
blending to like some
Yeah.
kind of interest in that as like a topical one, right? That you're
Yeah, how does he know that professor?
There's like
Yeah.
consultants. Yeah.
Also just like his, I don't know, his trustworthiness as a character, I feel like comes into question.
Yep, so let me have you pause right there.
Okay.
So, and let me intervene. Did you like him?
Yeah.
At first,
I was very skeptical of him at first,
yeah.
but I was very skeptical.
I mean, for a while, we were like, I think confused and we were like, what if he is like, we were like, the jawline, I don't know. So after we got over that.
You got over it?
I think I got a block, yeah.
Once he made that phone call, didn't feel part of this now.
Hmm.
Like my mind was switching between either he caused this
Right.
or he's like actually trying to save them. Like as if you're quick thoughts. So,
And because of the outcome, you thought he was genuine,
yes.
because it wasn't a great outcome. And so you're gonna say?
Well, I was just gonna like kind of like I don't know. At first, like Evelyn was saying, like you're not sure if he's like a part of it. And you're like his trustworthiness comes into question because it's like you don't know how long he's known the information he knows, right? Because without him, Ellison wouldn't have found that occult studies professor. Without him, like he wouldn't have found the street names, he wouldn't have found like the connection. So it was like, is this all of this information and he's just handing out piecemeal like as he wants? Because even the end phone call being like, this is what yeah, as soon as he moved.
Mhm.
So I don't know what that kind of falls under in terms of like if he himself, but psychologically.
Anybody not like him?
It was just hard. I just didn't trust him most of the time, but it wasn't like that.
So you
Yeah.
didn't trust him, but you liked him.
I like because he was like, he kind of played like a quirky little funny like character with this like, oh, I want to be your detective so and so. Like that was cute.
Oh. Funny, quirky, but may
Yeah.
have contributed to an axe murder.
Right.
Complex character.
I feel like I just didn't like him initially because the main character,
Yeah.
like he, like Ellison was so quick to trust him, like I felt like
Right.
he put up a really tough wall and all of a sudden he's like, oh, actually, yeah, you actually can help me. Then I was like, oh, so you trust him, so I don't trust him, because I think that Ellison is like that.
So you kept that
My
seeing it through
proxy.
Ellison, which is like, common, yeah. All right. Other thoughts on Deputy So-and-so or any other characters like to discuss?
Not a wife, a little bit of, I think she's got a really dependency. You know, she refuses to leave Edison, even though there are so many like reasons why.
So many ways.
And this is clearly not his first time doing so, kind of unstable, and you know, he's bringing up family to financial ruin and all of this, and she's like not leaving. And she's still like, oh, I'll take care of you, like, oh yeah, I'm sorry, like I didn't mean to do this, and she didn't do this. She's very like apologetic, and passive. So we did have the personality.
Which again, might be well within the realm of normality, right? Even when you rotate through EM and you see someone come in as a victim of domestic violence, right? You discuss with them the options and they say, no, I want to go back home. And I think the countertransference is, wait a minute, what? But you have to respect that, right? You have to give them the proper numbers and the resources available, but it's not like you're going to stop them, right? It comes up on boards all the time. So that would be applicable here too. So,
I just think it's because I was like, probably, I take it back. I think I think more that she's like one of the people manipulative relationship, because I think Allison is very manipulative.
Yeah.
And even when he's like, well, I didn't lie, I said that we were living, not living 2 houses down.
Yeah.
Yeah, I think she's, a victim of that.
yeah,
I take it back.
and I want to make sure everybody's on the same page because, and I'll share this. There is zero chance, right? That's the first time he did what he did.
Yeah.
In terms of that level of deceit
Yeah.
towards his wife and his family. And I would suggest that this is not the first time that he's put his family in danger, right? For his own whatever, or his own fame.
I almost think that, not, I don't know the words caregiver, but caregiver guilt. When he gets into these episodes, she takes on like the role of taking care of the children, like his job is to sit in his office, close his doors, he like seems to run whatever else outside. And it's like a guilt to stay there.
But remember what I said. I mean, everything is normal until it's not. Provide me evidence that that's out of the realm of normality, because that happens, right?
Yeah. And it's like,
But there's evidence in this movie. What is it?
you mean, like evidence that it's
That-
not normal for her to be taken care of in this way.
Well, the way that is the result of her taking care of her family in such a way is clinically significant. Why?
Did I cry?
Yeah, I mean, I think Ashley's suffering a tad,
Yeah.
right? Yeah, Ashley's an angry little girl.
Yeah, because you see, like, you know, when she brings him coffee and he's like, thanks, like shuts the door.
Yeah.
Like,
She is starving for her father,
Right.
and in all efforts to make the family right, mom is trying to cover for that, compensate for that, but she can't. And just ask Ashley if she's successful in doing it. That's not to blame mom. That's to identify that she's unable to actually be able to compensate for this patriarch who absolutely is not only mentally ill, but has his mental illness resulting in clinically significant impairment of others interpersonally. Right.
I love the scene where, at the kitchen table in the morning, he brings up like about his son's night terrors and his daughter shuts through, go ahead and I know too, and he's like, basically like, knock it off, like,
That's not good.
this
Yeah.
doesn't matter.
Yeah.
Like,
Right.
Yeah.
100%. Yep. And when she approaches him with an axe, what does she tell him?
Why don't we do that?
Yeah,
I mean, that's not
yeah,
right.
right.
She really did. I was like, that was a power line.
Yeah.
Yeah.
Right. And she's right. Here we are talking about him.
Yeah.
Right. I'll make you famous. Right. So again, I mean, starving for her father, he's chosen his own fame and not fortune, but he's chosen his own fame over his family, and his daughter resents him for it and tells him at the end, I'll make you famous. Right. That's something she's kept in for a while.
Yeah.
Right. And we see that kind of come through in her painting as well.
Mhm.
Right. Which for children is not out of the realm of, expectation.
Also interesting, like all the paintings suddenly become like really large and really big, and she's like kind of like have this, he's like right, he's like always limited to one wall, and now it's like these giant paintings all over the hallways, and then also she has a like smaller one that they show at the end, but like leading up to this kind of like bigger stories, like she's like kind of exploring in this freedom a little bit.
Yeah.
Oh, yeah. Oh, yeah. So I mean, unfortunately, I can't get too into what ails Ashley from a child adolescent perspective. I'm gonna call Dr. Lowry in here. But she's certainly struggling. Right. Well, yeah, we can get into this a little bit because it's purely theory. And I honestly don't know to what extent it really does inform psychotherapy. I would guess that for people who are analytically oriented, it's fairly straightforward. But not everybody is analytically oriented. Like, not everybody practices psychoanalysis. But if you were to evaluate someone with anorexia nervosa, we know that it's a very chronic, debilitating illness with a significant high rate of both morbidity and mortality, especially within psychiatry. The cause of anorexia is multifactorial, biopsychosocial, and often deals with some order of control and need to gain control. With all that stated, and I think that's fairly straightforward psychotherapy or treatment planning within psychotherapy. The analyst takes it one step further. Okay, whether you agree with it or not, it's theory, and that is, what are some aspects of the individual, usually a girl's developmental history, that we find somewhat consistently, that then often becomes the focus of therapy in cases like this. In addition to the idea of power and control, etc., what are some other aspects in the etiology and development of children that pose risk for anorexia in particular? Yeah, so they start to believe that they are overweight despite being underweight, right? What else? What causes that belief and that fear of gaining weight? And for any child, others starts where? At home, yeah. So now we're looking at the parents and the role the parents play in the risk for future eating disorder and anorexia in particular. So tell me a little bit more about the quality of the child-parent relationship. Anything that when you inquire about developmental history would not surprise you, that is consistent with the medical literature once you begin asking this within your evaluation? It's usually enmeshed, okay? Overprotective, sometimes not described by the child, described by the literature as omnipresent. And this need to separate, right? This need to become my own person, which is why this usually peaks in adolescence when individuals are trying to find who they are, right? So that's the struggle. There's also very often a history of early childhood sexual trauma, right? So all of these things, not straightforward. These are not linear. However, they're all on the table when it comes for the clinician to investigate, right? Not to investigate them would be inconsistent with the current literature, right? And analysis, theory. The individual, it's usually a girl, feels that she needs to escape from the omnipresent mother. And the way in which she does it, per Sigmund Freud, is through the defense mechanism of internalization. She internalizes the mother object and then starves her to death, which becomes manifest as an eating disorder. Right? It's a way to symbolically kill off mom, but the superego will allow it, right? Because it's not violating any rules or taboos of our culture. And hence we have the etiology, the origin of eating disorder, right? And in psychotherapy, specifically psychoanalysis, this sometimes actually gets approached, right? Now, in this particular case, dad is absent, mom is the caretaker, so mom is going to be, unfortunately, the focus of this little girl's attention. Although certainly by adolescence, she's able to have a conscious awareness of how much she hates her father, right? So this film turns out to be a film about both patricide as well as matricide. And the reason why I wanted to bring this up is, again, just to give you a flavor of the next film you watch. and not necessarily when I'm assigning, but generally speaking, when you watch future films, is that any film in which you see matricide cast, I want you to think as a symbolic ideology of eating disorder. And wonder if this is about eating disorder. Because as soon as you think that, you begin to look for other clues. What's the family dynamic like? Are they wearing loose-fitting clothes? What are some other aspects of eating disorder, anorexia in particular, that I want to look out for? Right? Because sometimes it clicks. And sometimes the idea of eating disorder as a provisional becomes validated and supported. Right? Ashley Oswald does kill her mother. Right? Now, I know that the father's death is the one that's dramatized, but she does commit matricide. And she's very angry. And it's just food for thought. If you were to rewatch this, I suggest that you focus, you might want to read board review in terms of anorexia, but then watch it with the eye towards whether or not those signs of anorexia were right there and you missed it the first time you watched this. Because there are some that are there. Thoughts, comments, feedback?
I'm just trying to think about all the scenes in which they are at a table eating, and how they will interact with food, like.
Yep.
Very specifically. I think about like the first dinner scene when they're just sitting together, and I don't know, I mean, they're mostly talking about like financial state, which was gonna be, like, it was more, I think like mom says, like, when we make, or dad says, like, when we make more money, we'll be able to buy more food or something to that effect, and like, mom tells Ashley, like, no, you can't have like seconds or whatever. And I think in that context, they're talking about like the financial state of the family, but yeah, and also, mom being restrictive of like daughters eating, which can be like, that's something we've seen, that can be seen in like a lot of cases as well.
And just a bit of a broader context, there might be some boundary issues that come to our attention with this family. I mean, to be discussing finances and making those comments in front of your kids is somewhat taboo for a nuclear family.
Right.
You don't do that. And they do.
Especially if they're-
Right, exactly. So again, I don't suggest anybody rewatch it, but Sunday is October 1st, and just the season to watch everything horror. But if you choose to, pay close attention, because there's some stuff there that you very likely missed, but all of a sudden you begin to look at a little differently now with this working theory about potential eating disorder. Other thoughts about Ashley or any other characters in this book? So let's talk about the son real quick. Is it night terror or I'm sorry, sleep terror or nightmare? Sleep terror. Is that REM or non-REM? Non-REM, right? Which means what upon awakening? Right, he's not going to remember it, and he's going to probably be disoriented. Waking somebody up during non-REM phase usually lends to disorientation and amnesia over whatever it was that occurred during that phase of sleep. Right, that contrasts the nightmare disorder, which is a REM pathology. 2/3 of REM occurs in that final sleep cycle. And nightmares are usually remembered. Right. Any questions about the differentiation here?
I think that's about treatment.
Yeah.
What is the treatment for, so they said you grow out of sleep terrors, but the nightmare disorders or like chronic nightmares, like, is there a treatment for it really besides like, oh, it'll just confuse with time?
So sometimes we use alpha agonists, prazosin, disrupting REM. Disrupt REM, you disrupt nightmare.
Okay, but isn't that done, you're using like sleep time?
You might disrupt REM, but remember, non-REM is the restorative sleep. Right, and some people find it helpful. In my experience, it either works or it doesn't. Right, and we often try it on the surface for people with